Hello again, this is Mark from Newsweed.com, and I'm reporting to you about the action on BNGO today. So everyone's happy that the price went up, and not many people listen to me about not buying the stock today, but just holding. Well, I hate to tell you this, but that's exactly what the shorts wanted you to do. Usually during the day, they'll bring the stock price up, and then they'll bring it down, each time notching you down on the price. There was some good news today on the stock, but not good enough news to move it way up to $5.90. So what I believe, is that tomorrow the stock in the free market will rise again. I think the last time I saw it was $6.01. And then the shorts are going to come in and they're going to slaughter the stock, because you have the fear taken outside of the share price. So they're going to get your hopes up, and then they're going to run the price down, because a lot of buyers are going to come into the market thinking that the price is going to start rising. Unfortunately, not enough people listen to me, and you don't realize that the shorts have enough money to buy the stock to drive it up, and then to sell the stock off before the price drops and buy more shorts. So that's what's going to happen. Tomorrow, the price, you're going to get caught if you bought yesterday, rather today, or if you buy tomorrow morning. Now, I could be wrong. If that's the case, I totally accept it. But I believe that this stock is under accumulation. All the time of this shorting, the stock is under accumulation, but also by the same people. They're making money as the price drops and then cover. Then they do it again and again. And because retailers, that's right, I'm talking about you, are so gullible, you don't know how to play the game with them. So let's see what happens. Tomorrow, hopefully you'll listen and you'll hold. Don't buy, because these guys are going to drive the price down. Once we get closer to earnings, around the 28th or so, then I would suggest you can start buying, because the shorts are going to be too scared that the price is going to jump up, because we definitely had a nice quarter. Now, other things that happened today, obviously I'm sitting in a hospital bed, but by coincidence, the CEO of the corporation, of the hospital that I'm in, they own 17 hospitals, I was able to talk to him about genomics. And, they kind of told me that the genomics that they have here is kind of limited. The CEO suggested to have one of his representatives stop by and give me what they have. I plan on donating a Sapphire machine here. I've been in this hospital several times. They have 17 hospitals, and the CEO was actually very interested. So I'm not going to say the name of the hospital, but Medical Center now offers one of the only comprehensive high-risk genetics clinics in the region. I'm in a major metropolitan area. The clinic provides support for men, women, and families who are predisposed to cancer-causing genes or are currently living with cancer. The use of genomic testing for targeted therapy of tumors is a tremendous advancement in the treatment of breast cancer, as well as many other cancers such as pancreatic, cervical, endometrial, and ovarian. This type of precision medicine uses information about a person's genes and proteins to prevent, diagnose, and treat their disease. The program is especially designed to address the complicated aspects of a hereditary cancer assessment. Each patient has the opportunity to meet with several specialized cancer experts and a genetics counselor in one convenient visit to assess their individual and family risk screening, needs and prevention, and treatment options. As a scientific field that has progressed a great deal in the past decade, genetic knowledge opens a whole new area of therapies that were previously unavailable to prevent and treat cancers. Bringing these innovative resources to our local community advances our mission and commitment to being at the forefront of cancer care. So basically, they have one page here, and that's their genomics department. I plan on, if the price rises as I promised, to $25, to donate one machine here and bring it to uh, this university hospital so that they can begin studying genomics. I will not buy any of the uh, pieces that go into the machine. They cost $500 each. That'll be the responsibility of the hospital. But the fact of the matter is, Sapphire lowers the cost of doing these genomic tests, and that's the nature of it. I think when a hospital like this, which is a major, major corporation, uh, catches on to a Sapphire and they're able to make profit with the Sapphire by diagnosing patients, then it's proof positive that uh, the product is very saleable. And furthermore, the fact that they don't really have any big genomics department here shows that we are just at the infancy of this industry, and that BNGO, Bionano Genomics, is going to truly be on top of its game once it can reach all these hospitals. And I would say their sales force has to be as effective as I am, obviously. I happen to be a patient here, so the CEO definitely wanted to talk to me. I think that it just shows the opportunity. Now, this paperwork here that I have with me, actually, the CEO talked to me in the morning, and by afternoon I had this documentation. And I've been invited to the Genomic Center, in which I hope to have someone from BNGO bring data or bring a machine to demonstrate to this hospital. Because after all, I'll be donating it to the hospital, providing the stock price goes up to $25, which I believe it will at least. My target is $75 and not such a long term. So anyway, my name is Mark Nejmeh. I'm from Newsweed.com. This is not financial advice. This is just for your entertainment and for my entertainment, since I'm bored out of my mind in this hospital and waiting to get the cut, if you know what I mean. So I'll be going under a bit of a knife within a day, and just resting up after my heart attack. But I hope to see you all soon. Hello there, Mr. Auspicious Descent. Hello there, Mr. Invest-A-Lot. And hello there, Frunkler. I hope you are all well, and I hope you keep informing people to, at this point, not to buy the dip, because the shorts are playing. Once we get closer to earnings, then you can tell people to buy, buy, buy. But we must win against the shorts. See you later, folks. God bless. Bye-bye.